This is Selma Schimmel for the group room at the San Antonio Breast Cancer Symposium. We are joined now by Dr. Kent Osborne, Professor of Medicine, Director of the Dan L. Duncan Cancer Center, and the Lester and Sue Smith Breast Cancer Center at Baylor College of Medicine in Houston. Hello, Dr. Osborne.
Good afternoon.
I believe you are the co-director?
Yes, there are three of us now. Myself, Peter Abden, and Carlos Arteaga are the three co-directors for the meeting.
And while I called it the annual San Antonio Breast Cancer Symposium, and actually this is the 35th year.
Correct.
So it's a very significant year, milestone year. Let's clarify for our viewing audience the participating organizations that now compose the symposium.
Well, as you know, 35 years ago, it was started by our group in San Antonio. Bill McGuire and Chuck Coltman were the leaders of it, and I was a new faculty member at the University of Texas Health Science Center at the time. And so we began planning a meeting, and Dr. Coltman's secretary was the administrative person for the meeting, and the first few years was a small meeting with mostly local oncologists, although we had a lot of really important people coming to give lectures. And then we decided, after a few years of that, to invite people to submit abstracts of their research that would then be selected by a committee, and they would present at the meeting. And that's when the meeting really started to take off. And now we have over 7,000, probably close to 7,500 attendees from 100 different countries. And it's now the largest breast cancer research meeting in the world.
Let's talk a little bit about the partner organizations.
In 1999, my group and I, most of the breast program at the time at the University of Texas Health Science Center, moved to Baylor College of Medicine in Houston. So we continued to play a major role even though we moved. And that was the initial partnership between Baylor and UT Health Science Center here. And then a few years ago now, as I saw the future of cancer in general, but particularly in breast cancer, that we were really going to have to understand basic science in order to make improvements in the clinic, that we would bring in another organization that would help in that regard, and that is the American Association for Cancer Research. So we brought them into the group, and in order to maybe bring in additional basic science and translational research to the meeting. Dr. McGuire at the beginning always felt that the meeting should be in one room, that the basic scientists shouldn't be over here and the clinicians over here. They should hear what each other has to say. And it was really, that was translational research before we had the word translational research.
Would you define for our viewers what translational research means, please?
Sure, yeah. There's a variety of different definitions, but the one that most people use and the one I use is that it's basic laboratory research with the intent of bringing the discovery to the patients and to the bedside as quickly as possible. And that within a very short period of time, you're testing whatever the discovery is that you made in people. And so that's translational research, and it's really caught on. Many people now are doing it, people who were formerly entirely basic scientists working by themselves or clinicians working just in clinical research have now grown closer together. And I think the product of that is what you see at the meeting, a lot of really good translational science that's going to have an impact on patients.
And for patients to understand how dynamic this meeting is, because it is an integrated meeting and these disciplines are working together. And I think that's a very hopeful and inspiring thing for patients to understand what really goes on.
I would agree with you. And I think, first of all, just clinical care of breast cancer requires multiple different physicians and expertise, from the pathologist, the radiologist, the surgeon, the reconstructive surgeon, the medical oncologist, the geneticist, specially trained nurses. It's really a team, and the patient becomes a member of that team. And if the patient is being taken care of at an optimal place, all of these people will be working closely together, have meetings together, communicate regularly. What we've also tried to do is then bring in the basic scientist into that team. And that's becoming more and more important as we move on into personalized medicine and genomic sequencing and that sort of thing that you've heard about.
And I also want to acknowledge and thank all of you for the way in which you have included the patient voice with your extreme involvement with the patient advocacy movement. And the advocates that are here have become rather significant players at the meeting as well.
Yes, they have. It was important to us, and I think probably Chuck Coltman, who was one of the co-directors early on, until just recently, he felt it was very important, and I agree with him, to bring in survivors, patient advocates, lay people who could give their orientation and their comments. While this was happening at the meeting, it was also happening at a lot of other institutions. So cancer centers began to include advocates in their role. SPORE grants, the so-called Specialized Program of Research Excellence grants, then required patient advocates to be part of each grant. So over the years, patient advocates have become an integral part of this team. We even had one that chaired a session this year. Susan Raft from my group chaired one of the scientific sessions. So now we don't even distinguish them so much as patient advocates. They're a member of the team, just like a surgeon or a medical oncologist might be, and they provide an important perspective.
First of all, Dr. Kent Osborne, congratulations for a fabulous meeting, your 35th annual meeting, and for giving Vital Options and the group room a place here every year, as we do, to talk about these things.
Well, you're welcome, and thanks for coming.
Dr. Kent Osborne, co-chair of this annual San Antonio Breast Cancer Symposium, professor of medicine, director of the Dan L. Duncan Cancer Center, the Lester and Sue Smith Breast Center at the Baylor College of Medicine in Houston, Texas.
Thank you, you too.